Let's talk about hMPV now. At least 5 confirmed cases in India so far. But the big question is, should you worry? Ministers have been trying to assure the public of safety and the need to not panic. Most importantly, Health Minister JP Nadda as well has issued a statement saying that the ministry is closely monitoring the situation. Listen in.
चीन में जो hMPV वायरस के मामले पर हाल ही में आई रिपोर्ट्स पर स्वास्थ्य मंत्रालय ने इंडियन काउंसिल फॉर मेडिकल रिसर्च के साथ और नेशनल सेंटर फॉर डिजीज़ कंट्रोल के साथ और वर्ल्ड हेल्थ ऑर्गेनाइजेशन के साथ चीन सहित पड़ोसी देशों में स्थिति पर कड़ी निगरानी रखे हुए है। WHO ने भी स्थिति का संज्ञान लिया है और जल्द ही वो भी अपनी रिपोर्ट साझा करेंगे हमसे। ICMR इंडियन काउंसिल फॉर मेडिकल रिसर्च और इंटीग्रेटेड डिजीज सर्विलेंस प्रोग्राम IDSP के साथ उपलब्ध सांस संबंधित वायरस के देशव्यापी डेटा को भी समीक्षा की जा रही है।
All right, Dr. Abhirup Sarkar, Laboratory Director at Suraksha Diagnostics, with us this morning. We're also speaking with Professor Suneela Garg, Chair of Program Advisory Committee at the National Institute of Health and Family Welfare in Delhi. Welcome to both of you. Very good morning, Dr. Garg. Professor Garg, actually, let me begin by just getting your view on the pace of spread of the cases. When people are watching this and they're saying, okay, 5 cases, now 7 cases, the worry is that, is this something which is already endemic in our country? Because the first few cases are in newborns who haven't traveled outside India. Is it very much here, and how dangerous could it be?
See, first of all, very much good morning to all of you. And I wanted to say that, when we talk about hMPV virus, that is human metapneumovirus, as the name suggests, basically it is related to respiratory infections. And primarily the symptoms are with regard to respiratory infections like cough, cold and all that. But predominantly, this is also a season for cough, cold and, the respiratory infections, because not only hMPV virus, but we do have flu virus, respiratory syncytial virus also in circulation. So we don't have to worry much about it, but then, we have to look at certain age groups, like infants, when we talk of children who are less than a year, or when we talk of elderlies who are 65 years and above. So we need to be more cautious. And amongst those who are infants, particularly who are born with low birth weight, and India is known to have almost 30% of children who are born with low birth weight, and we do have preterm babies. Plus, people who are 65 years and above, who are immunocompromised, who are suffering from comorbidities, we need to be cautious with them. So those who are suffering from these symptoms, they need to isolate themselves. But as far as the country is concerned, we need to be vigilant. We need not panic. But of course, our systems are already in place because we prepared the systems during COVID times. So our system preparedness is there, our human resources preparedness is there. The whole purpose of this media program should be that we need to create more and more awareness amongst masses so that, we can reach the last mile and people become more aware of the symptoms, and they need to rather consult the healthcare providers as soon as they feel, particularly when we talk of, wheezing, or when we talk of, severe breathlessness and all. In that case, a healthcare provider must be immediately consulted also.
Okay, so the most vulnerable age groups are young children below the age of 1, in fact, is what Professor Garg is saying, and those who are above 65 and have comorbidities or who are immunocompromised. But is there enough out there to test them? Dr. Abhirup Sarkar is joining us now. He's Laboratory Director, Suraksha Diagnostics. Dr. Sarkar, just trying to understand that, do we have accurate current testing mechanisms for this? Because from what I understand, we're using the PCR tests, which we used for COVID as well. But this could be a slightly different kind of virus.
Absolutely. It is generally detected by the PCR method. And as we have said, we know very well about PCR method, and during COVID times, we have used it extensively in our labs. And the testing for hMPV is actually available for years now. And most of the top labs like us also, we are doing hMPV tests for several years now. We are doing it as a part of a respiratory comprehensive panel. So that includes multiple viruses that are generally causing the upper respiratory tract infection or lower respiratory tract infection. And we can test hMPV singly also through RT-PCR methods. Those are already well known. And most of the labs are already equipped to do this testing. If any surge comes, we are well equipped, and India is well equipped to do that.
What are the current sort of testing that you have, for example, and what are the costs of these tests, Dr. Sarkar?
Yeah, so generally, if you test as a part of comprehensive respiratory panel, the price can be 10,000 to 20,000. And you can test it singly as a single human metapneumovirus detection. It can cost you around 2,000 to 3,000 rupees.
So 1 minute. So are you saying that the current test for hMPV is 2,000 to 3,000 rupees? That is available in the market right now?
Yes, it's available in the market.
And a comprehensive one can be up to 20,000 rupees. Is that what you said?
10 to 20,000, yes. Exactly.
10 to 12,000 rupees. So, you know,
10 to 20,000.
10 to 20,000 rupees. All right.
Yeah.
So
it depends on the sample type you are using. So you can do it for upper respiratory. So that will be a nasopharyngeal panel. You take the swab like COVID, but it can also cause pneumonia. So if you are testing for lower respiratory tract infection in some immunocompromised person who is having pneumonia due to human metapneumovirus, then you can test for sputum or bowel fluid or like that. Then the cost can be slightly higher.
So Professor Garg, here's a problem, isn't it? Because as the fact is that we need to detect cases at this point.
Yeah.
And then you have tests that cost at this level, and that's going to cause some concern.
See, definitely, I'll say that it is not that cause of concern, because we need to look at the individuals, their symptoms, the signs, that means with what they are, what the doctor is eliciting, and then we go for testing. And as far as I'm aware, during COVID times, we brought down the cost very much low to as low as almost 500 rupees, because this is a point of care test now, which is easily available. We do have a technical know-how, particularly all the healthcare facilities in government setup, where we are talking of, different level of laboratories. We have prepared the systems, and we need not worry about that, because the data also goes to IDSP platform. So, we need to see that exactly how the costing, particularly in private sector, also needs to be brought down. That is important part, because this is point of care test, which has been already well developed, and we need to see that how, basically it is available to everyone if it is required. That is important, because it is a self-subsiding infection. Most of the cases, they subside within 3 to 6 days also. But only thing is we need to be worried about, as again I said, that about our infants, children less than 1 year, because in them, the pneumonias could happen, and particularly in elderly population and people who are comorbids. So we need to, as I said, be vigilant, and we need to also test, with very, very comprehensively. That means we need to see that people who require to undergo all this, that is important, because against 5 cases which we are talking today, or 7 cases, each case there is almost a load of 100 subclinical cases.
Okay, I think that's an important point, that the number of cases doesn't mean that all of these are severe infections. That's something that we've learned from COVID, and that's what we should keep in mind. Thank you so much to both of you for joining us on this segment, where we're just trying to give our viewers right and expert-backed and factual information on what is clearly a cause of concern.